Doctors sit through years of schooling so that they have the knowledge and confidence to care for patients. And though we often trust them with our lives, medical professionals are still human. Even after all their training, no one is perfect. These mishaps can lead to medical malpractice, which is when physicians act outside the standard of care.
Standard of care, to be sure, is a legal term. It's not a medical term, but it's loosely defined as what any reasonable physician would do in the same circumstance. So malpractice is then said to be a violation of that standard of care.
That's Dr. Stanley Berry, a professor of obstetrics and gynecology at Wayne State University. He says that there's no blanket definition for what standard of care is. In fact, it can change depending on the hospital and in what region of the country you're in.
In urban areas like Chicago or Detroit, to do obstetrics and gynecology without having an anesthesia person in the hospital would be considered below the standard of care. But if you got into very rural Illinois or very rural Michigan, you may have a small hospital that does obstetrics and the anesthesia people are outside of the hospital on call. And the consequence of requiring them to have an anesthesia person in the hospital would possibly mean the closure of the hospital.
So the standard of care changes based on the realistic options for each hospital. Anesthesia is needed in case doctors need to perform a C-section, in which case Berry says the whole procedure should take half an hour, according to the broadest standard of care definition.
Now, in a big hospital like Advent or Lutheran Hospital, in reality, if they make a decision to do an emergency cesarean section, they can have the baby out in 15 minutes, let alone just making the incision. But in a rural hospital, although they probably should be able to meet that standard, it's going to be tougher because you don't have anesthesia in the hospital.
Some of the most common types of medical malpractice include misdiagnoses, surgical errors, and birth injuries. If a doctor fails to disclose important information, they could also be charged with malpractice. In fact, Berry writes about this situation in his new book, A Fight for Full Disclosure. Though it's a work of fiction, Berry draws from his own experience witnessing these cases.
We're talking about full disclosure in a situation where the patient outcome is suboptimal. And full disclosure then is a process whereby the hospital approaches the patient or the patient's family or both and says to the patient, we want to sit down and talk about what happened. Here's what happened. We know that things didn't go the way we wanted them to go. And obviously the outcome here was suboptimal. Therefore, we are willing to make a monetary offer, not that the monetary offer is going to cure the suffering that you have undergone because of the incident, but in our society, that's the way we come to terms with situations like that.
Berry says accusations of malpractice are investigated by a review committee within the hospital. Though the time frame varies, the process often takes a couple months.
They are sometimes effective. And by effective, I mean that they bring about change in behavior on the part of the physician or change in behavior on the part of the hospital.
However, he says that many factors play into how effective these review committees are. For instance, the American Hospital Association reports that in 2022, 82% of all hospitals are privately owned by either nonprofit or for-profit organizations.
And so the hospital is in a conflict of interest situation when it comes to disciplining people who bring business to their facility. I've seen hospitals do it, big hospitals do it, to people who bring lots of patients, but I believe that that's the exception and not the rule, because I'm privy to information that would shock people about what physicians are allowed to do and that they're not called on it.
Because of these conflicting interests, Berry says the investigations aren't always as effective as they should be. When he was tasked with instituting a patient safety program at his own hospital, Berry's first order of business was changing the privileged mindset of physicians.
physicians could do almost anything, and at most they would get slapped on the wrist. And that changed under my leadership. I actually had to send a couple of physicians away to get regrouped, as it were.
Berry also made a point to stand up for the review committees. He says that at the time they held no power and any recommendations they made were ignored.
I went down and I remember and had a talk with both of these committees. One was obstetrics, one was gynecology. And I said, you review these cases, you make their recommendations, and unless you recommend that I bring the physician out to the central courtyard and remove their right hand, I'll follow your recommendations.
Berry says that while many of the cases were minor, these checks were necessary to make sure the standard of care was being upheld.
You meet lots of resistance in trying to do that, but I think that hospitals need to have patient safety programs, and full disclosure can nicely be incorporated into the whole overall scheme of improving patient safety.
Surprisingly, Berry says many of these patient safety techniques come from the airline industry. One main component is the concept of situational awareness.
In other words, always being aware of the situation around you. And that may sound trite, but to give you an example, there might be certain procedures that are elective, like trying to externally rotate a baby from breech to head first. Well, if you know that you can't do an emergency cesarean section because all of the people who help to do that procedure are tied up, then you would be aware of that situation and you would delay that purely elective procedure until that emergency capability was ready again.
Hospitals also followed the airline industry's footsteps in breaking down the professional hierarchy. This makes it possible for anyone to interrupt a situation if they notice something going wrong. All of these practices act as the first line of defense to protect against medical malpractice. But what can we as patients do to help?
Ask questions and get answers. And it's a fine line with many physicians between aggressively getting the answer and turning the physician off to the point that they decide essentially to stonewall. So it's a diplomatic balance.
Berry says it can be a fine line between asking questions and interrogating your physician. He advises patients to get to know their doctor before jumping into the discussion.
Some physicians you could interrogate like you're the police in an interrogation room, and they wouldn't lose a beat. Others, by the second question, they're on the defensive. So it's a tough situation for patients. It really is. And knowledge is the key. And I always used to tell my patients, I think it's great when you go on the internet and read things. But remember, the internet is the biggest source of information in the world, and it's also the biggest source of, and I'd want them to finish the sentence, and most of the time they would, it's also the biggest source of misinformation. So I said, go and read about these things and bring your questions to me. Just understand that what you read may not be the whole truth, or it may not be the truth at all.
You can find more information about Dr. Stanley Berry and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
As a conservation biologist, you're often concerned with eating too much. But it occurred to me that maybe we could flip the script a bit and think about ways that we could use our appetite in a good way.
Can changing your diet save endangered animals?
Then, is the average American diet killing us?
The bulk of the evidence really supports that these foods are detrimental for our health and may increase the risk for obesity and chronic diseases.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I was very, very fortunate to work with some of the top chefs and pastry chefs in Boston and in New York, and that really helped me build a very strong foundation.
It's never too late to follow your passion. Then, In the last 4 years, we've seen an unprecedented rise in sports betting. Nearly more than 30 states have now legalized some form of sports betting, either in person or through mobile sports betting application.
The all too accessible world of online sports betting. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.